Hey everyone, welcome back to the deep dive. Today we're gonna step into like a really fascinating world.
Oh,
Bugs and beyond.
cool.
Your one-stop shop for all things infectious disease. But before we jump in,
Okay.
let's just take a moment to appreciate the amazing resilience of the human body.
Yeah, that's pretty cool.
It's pretty cool, right? How we can fight off so many invaders.
Yeah, smell it.
Okay, enough Zen for now.
Okay.
We have some super interesting lecture slides here
Okay.
on lipoglycopeptides,
All right.
a class of antibiotics that pack a serious punch when it comes to battling those tough bacterial infections.
Yeah.
You'll be amazed by how these medications work and what makes them special. We even have some fun mnemonics to help you remember key facts.
Cool.
Let's dive right in.
Okay.
Why are these lipoglycopeptides so important?
Well, you've probably heard about antibiotic resistance.
Right.
It's a big challenge we're facing in healthcare. Bacteria, especially those that have become resistant to our usual antibiotics, pose a real threat.
Yeah.
Lipoglycopeptides offer a new line of defense,
Okay.
helping us tackle those tricky infections that don't respond to other treatments.
Wow, that's like having a secret weapon in our arsenal.
Right.
But before we get into the specifics,
Yeah.
I have a question for you, listener. Have you ever taken an antibiotic?
Yeah, probably.
I'm guessing many of you have,
Right.
considering how common bacterial infections are.
Definitely.
All right, let's meet the stars of today's deep dive.
Okay.
Telavancin,
Right.
Dalbavancin,
Okay.
and Oritavancin.
Cool.
Don't worry.
Yeah.
We'll break down these names and make them less intimidating.
Okay.
Promise.
Mm-hmm.
So, interestingly, these drugs are actually related to vancomycin,
Yeah.
a very powerful antibiotic
Right.
that you might have heard of. Understanding how vancomycin works
Yeah.
can help us grasp the basics of these newer lipoglycopeptides.
Absolutely. That makes sense. Yeah. It's like building on a foundation. Once you understand the OG,
Right.
it's easier to grasp the next generation, right?
Exactly.
Okay, enough introductions. Let's
Yeah.
get into the nitty-gritty
Oh.
of how these medications work their magic.
Yep.
Lipoglycopeptides are unique
Yeah.
because they have this awesome dual mechanism of action.
Yeah.
They not only interfere with bacterial cell wall synthesis,
Right.
but they also disrupt the bacterial cell membrane.
Hmm.
Wait, hold on.
Yeah.
Two mechanisms.
Okay.
That's like hitting the bacteria with a 1-2 punch.
Exactly. That's a great way to put it.
Right.
Think of it this way.
Okay.
The cell wall is like the foundation of a house,
Okay.
providing structure and support.
Hmm.
The cell membrane is like the electrical wiring, controlling what goes in and out. Lipoglycopeptides disrupt both,
Right.
making it impossible for the bacteria to survive.
Okay. That's a great analogy. I can definitely picture that.
Yeah. So these drugs are like demolition experts,
Uh-huh.
taking down the entire bacterial house.
Right. But which bacteria do they target?
Well, lipoglycopeptides are primarily effective against gram-positive bacteria. These bacteria are responsible for a wide range of infections,
Okay.
from skin infections and pneumonia
Right.
to those scary bloodstream infections.
And don't forget those supervillains of the bacterial world, MRSA and VRE.
Oh, yeah. Those are tough ones.
These guys are notorious for being resistant to many antibiotics,
Yeah,
making them incredibly difficult to treat.
right.
So,
That's where lipoglycopeptides step in, as our heroes ready to take on those tough infections caused by resistant strains.
all right, now let's get a little more technical.
Okay.
We need to talk about PK/PD.
Right.
Basically, this means understanding how the drug travels through the body
Yeah.
and how it actually fights those pesky bacteria.
So think of pharmacokinetics,
Okay.
or PK, as tracking the drug's journey through the body.
It's all about how the drug is absorbed, distributed, metabolized, and finally eliminated.
Wow, that's a lot.
And then pharmacodynamics, or PD, focuses on what the drug actually does to the bacteria,
Okay.
its effects.
Okay, so PK is like the drug's travel itinerary,
Exactly.
and PD is its battle plan.
Yeah, a great analogy.
What's really interesting about lipoglycopeptides is their long half-life.
Yeah.
They hang out in the body longer, which means...
You don't have to take them as often.
Right.
This is a huge win for patients
Definitely.
who wants to be constantly popping pills.
Right. Imagine taking a medication once a day,
Right.
or even once a week,
Yeah,
compared to multiple times a day.
definitely.
That's a game changer for convenience. And let's be honest, remembering to take your meds.
Yeah, for sure.
Speaking of taking meds, what about dosage?
Well, dosing is crucial.
Okay.
And it varies depending on the specific lipoglycopeptide and the patient's kidney function. You see, the kidneys play a big role in filtering and removing these drugs from the body.
Okay, so that makes sense. People with kidney problems might need a different dose to avoid any potential side effects?
Exactly. Doctors carefully adjust the dosage to ensure the medication is both effective and safe for each individual.
Now let's talk about the not-so-fun part, side effects.
Yeah.
I know it's not everyone's favorite topic, but it's important to be aware of what might happen, right?
Absolutely. Like all medications,
Yeah.
lipoglycopeptides can have potential side effects.
Okay.
But the good news is that the frequency of these side effects is often comparable to other antibiotics. And most are mild and manageable.
Okay. That's reassuring.
Yeah.
So it's not necessarily a scarier option compared to other antibiotics out there?
Not necessarily.
But it's always crucial to have open communication with your doctor.
Right.
Let them know about any concerns you have.
Yeah.
Even if it seems minor.
Definitely.
Speaking of communication, there's another important thing you should always discuss with your doctor.
Okay, what's that?
It's vital to tell your doctor about all the medications you're taking.
Right.
Even over-the-counter ones and supplements. This is because some medications can interact with each other.
Yeah.
Leading to unexpected or potentially dangerous side effects.
Yeah, it's like a complex puzzle, isn't it?
It is.
All those medications interacting in the body.
Exactly. For example, Telavancin can have a potentially serious interaction with heparin, a blood thinner.
Right.
This is why it's so important to be upfront with your healthcare provider.
Yeah.
About everything you're taking.
Absolutely.
Wow. That really highlights how crucial it is to be open and honest with your doctor.
Yeah.
They can help you navigate that medication maze.
For sure.
And make sure you're taking the safest and most effective combination.
Definitely.
Okay, so we've covered a lot of ground.
Yeah, we have.
We've talked about why lipoglycopeptides are important, how they work, their target bacteria, and even touched on dosing and potential side effects. Now let's zoom in on why these medications are such valuable players in our fight against bacterial infections.
Okay. What really stands out to me is their effectiveness against those super tough infections, especially those caused by resistant bacteria. Plus, the long half-life means more convenient dosing, which is a huge advantage for patients.
For sure.
It simplifies their lives and helps them stay on track with their treatment.
It's like a double win.
It is.
Powerful action and less hassle.
Exactly. And in some cases, using these lipoglycopeptides can actually help avoid a trip to the hospital.
Wow.
Or shorten a hospital stay.
That's incredible.
Yeah.
Not only are they powerful fighters, but they can also help improve the overall patient experience.
Absolutely. And if we think about the bigger picture, this can have a positive impact on both patients' lives and the healthcare system as a whole.
All right, ready for a quick knowledge check?
Okay, bring it on.
We've got a multiple choice question that'll test your understanding of these amazing antibiotics. Listen carefully.
Okay.
And take a moment to think about the answer.
Right.
Here's the question. Which of the following statements is true regarding the mechanism of action of lipoglycopeptides?
Okay.
A, they only inhibit bacterial cell wall synthesis. B, they only disrupt the bacterial cell membrane.
Okay.
Or C, they have a dual mechanism of action inhibiting cell wall synthesis. A and D, disrupting the cell membrane.
All right.
Take your time. Think back to our discussion about that 1-2 punch action.
Okay.
What's the right answer?
The correct answer is C.
Yes.
Remember, lipoglycopeptides are like double agents, attacking bacteria on two fronts, making them extra effective. They disrupt both the cell wall, which is like the foundation of the bacterial house, and the cell membrane, which is like its electrical system.
Give yourself a pat on the back if you got that right.
Yeah.
You're well on your way to becoming a lipoglycopeptide expert.
Absolutely.
Now, before we move on to getting to know each of these lipoglycopeptide stars individually, let's have some fun and make this information stick.
Okay.
Who's ready for a mnemonic device?
I love a good mnemonic.
Me too.
They're like little brain hacks for remembering important information.
Exactly. So to remember the 3 lipoglycopeptides, Telavancin, Dalbavancin, and Oritavancin.
Okay.
How about this? Tel Aviv dances on beaches.
Oh, I like that.
Silly, I know, but it works.
It does. And to remember some potential side effects.
Okay.
Think Dr. D for diarrhea, O for osteomyelitis risk, especially with Oritavancin.
Okay.
C for QT prolongation with Telavancin. T for taste disturbances.
Okay.
O for other common side effects like nausea and vomiting.
Right.
And R for red man syndrome with rapid infusion.
Those, of course, these are just for fun.
Yeah.
And shouldn't replace carefully reading medication information. But they can be helpful memory aids.
Definitely.
Well, we've covered a lot of ground in this first part of our deep dive.
Yeah, we have.
We've learned why lipoglycopeptides are so important in the fight against bacterial infections, how they work their magic, and even got a taste of their potential side effects.
Yeah, for sure.
Right.
Welcome back to the deep dive. I'm excited to continue our exploration of lipoglycopeptides.
Me too. Last time we laid the groundwork, understanding why these antibiotics are so important and how they work.
Right.
Now it's time to meet the stars of the show.
Okay.
Telavancin, Dalbavancin, and Oritavancin.
It's like getting to know the members of a superhero team.
I like that.
Each one has unique strengths and a specific role to play.
So who's our first superhero?
Let's start with Telavancin.
Okay.
It stands out because of its unique structure, which contributes to that powerful dual mechanism of action we discussed earlier.
Ah, yes, the double whammy.
Right.
Interfering with both cell wall synthesis and cell membrane function. What makes Telavancin structurally unique?
It has a hydrophobic part that helps it anchor to the bacterial cell membrane and a hydrophilic part that enhances its solubility, allowing it to move easily through the body's fluids.
I'm going to need an analogy for that one.
Okay, imagine a boat with an anchor and a sail.
Oh.
The hydrophobic part is like the anchor firmly attaching Telavancin to the bacterial cell membrane. The hydrophilic part is like the sail helping it navigate through the body's watery environment.
That makes so much more sense.
Yeah.
So it's this combination of features that gives Telavancin its ability to attack bacteria on two fronts.
Precisely. Now let's talk about its journey through the body.
Oh.
Telavancin is administered intravenously, meaning directly into the bloodstream.
Oh.
It has a half-life of about 6 to 8 hours in people with normal kidney function.
Hold on, can you remind me what half-life means again?
Of course.
Okay.
Half-life is the time it takes for half of the drug to be eliminated from the body.
Okay.
So in this case, after 6 to 8 hours...
Yeah. Half of the Telavancin dose would be gone.
Got it. So the body gradually processes and eliminates the drug over time.
Exactly. And it's important to note that a significant portion of Telavancin is eliminated through the kidneys.
Okay.
This means doctors need to pay attention to a patient's kidney function when determining the right dose.
That makes sense. If someone has kidney problems, they might need a lower dose to avoid any potential complications.
That's right. Doctors use a measure called creatinine clearance to assess kidney function and adjust the dosage accordingly.
Okay, good to know.
Yeah.
Now, I hate to bring it up, but we do need to talk about potential side effects.
Yeah, it's important.
What should people be aware of with Telavancin?
Some common side effects include taste disturbances.
Okay.
Like a metallic or soapy taste in the mouth. Some people might experience nausea, vomiting, or even foamy urine.
Foamy urine.
Yeah, which can be a little alarming.
This is definitely not something you see every day.
Right, it's usually harmless.
Okay.
But it's worth mentioning to your doctor. Definitely any other side effects we should be aware of.
It's also important to note that rapid administration of Telavancin can cause something called red man syndrome.
That sounds intense. What is red man syndrome?
It's a reaction that can cause flushing itching and a rash, mainly on the face, neck, and upper chest.
So it's important to administer it slowly and carefully.
Exactly. And another consideration with Telavancin is that it can prolong the QT interval on an EKG.
Can you explain what that means for those of us who aren't cardiologists?
The QT interval is a measure of the heart's electrical activity.
Okay.
Prolonging it can increase the risk of certain heart rhythm abnormalities.
So caution is needed when using Telavancin with other medications that might also affect the QT interval.
Precisely, doctors carefully consider these factors to ensure the medication is safe for each patient.
Okay, so Telavancin is a powerful antibiotic with some unique considerations.
Yeah.
What about our next superhero, Dalbavancin?
Okay.
What makes it special?
Well, Dalbavancin is like the marathon runner of the group. It boasts an incredibly long half-life.
Right.
We're talking 8.5 days.
Wow.
With a terminal half-life of about 2 weeks.
Wait, 2 weeks?
Yeah.
You're telling me a single dose of Dalbavancin could stay in the system for that long?
That's the beauty of it.
That's amazing.
This long half-life allows for less frequent dosing.
Right.
Which can be a game changer for patients.
Definitely.
Imagine taking just one dose for an entire course of treatment.
Wow, that would be amazing.
Right.
No more struggling to remember to take your pills every day.
Exactly. And this can significantly improve adherence to treatment, which is crucial for its effectiveness.
Okay, so long half-life is a major win for Dalbavancin.
Yeah.
What else sets it apart?
Dalbavancin is a semi-synthetic lipoglycopeptide, meaning it's derived from a natural source but tweaked a bit in the lab. It has a specific chemical group added that contributes to its extended half-life. It's like giving the molecule a time-release capsule.
Ah, so that's the secret to its longevity.
And it also has another chemical group that enhances its activity against gram-positive bacteria.
So it's like a supercharged version specifically designed to target those pesky gram-positive bugs.
Exactly. Now, in terms of its spectrum of activity, Dalbavancin is similar to Telavancin. In that it's primarily effective against gram-positive bacteria, including MRSA.
Right, those tough MRSA infections that are resistant to many other antibiotics.
Yes. It also shows potent activity against Enterococcus species, including some that are resistant to vancomycin.
Wait, I remember we talked about vancomycin resistance earlier.
Yeah.
Didn't we mention something about Van genes?
You have a great memory. Vancomycin resistance is a growing concern, and it's often caused by these Van genes, like Van B and Van C. They essentially give the bacteria a shield against vancomycin.
So Dalbavancin can overcome some of these resistance mechanisms, but not all of them.
That's correct. Unfortunately, Dalbavancin is inactive against the Vanna phenotype, which is one of the most common types of vancomycin resistance.
Got it. So it's important to know which type of resistance the bacteria has before using Dalbavancin.
Yeah.
It's not a universal solution, but still a valuable tool in many cases.
Exactly. Now let's move on to dosing. With Dalbavancin, there are two main options, a single-dose regimen and a two-dose regimen.
So there's some flexibility there. What determines which regimen is used?
The choice depends on the patient's kidney function.
Right, so people with kidney problems might need a different approach.
Exactly. For patients with good kidney function, a single dose of 1,500 milligrams is usually enough. But for patients with lower kidney function, a two-dose regimen is used. 1,000 milligrams followed a week later by 500 milligrams.
So even with kidney problems, there's still a convenient dosing option available.
Right.
That's great. Now, what about side effects? Is Dalbavancin generally well tolerated?
Yes, it is. The most common side effects are nausea, headache, and diarrhea. Pretty similar to other antibiotics and usually mild.
That's reassuring. Anything serious we need to be aware of.
Like with Telavancin. Rapid infusion of Dalbavancin can cause red man syndrome. So it's important to administer it slowly over about 30 minutes.
So slow and steady wins the race.
Exactly. And one more thing to keep in mind is that there's a theoretical risk of cross-sensitivity between Dalbavancin and other glycopeptides, like vancomycin. This means that if someone is allergic to one, they might also be allergic to the other.
So it's important to check for any history of allergies before using Dalbavancin.
Definitely.
Got it. Well, we've covered Telavancin and Dalbavancin. Ready to meet our final lipoglycopeptide superhero, Oritavancin.
Absolutely. Oritavancin is another fascinating member of this powerful antibiotic family.
Bring it on. I'm eager to hear what makes it unique.
Well, Oritavancin is a synthetic lipoglycopeptide, meaning it's entirely created in the lab. One of its standout features is its activity against Vanna VRE, which, if you recall, is a particularly challenging type of vancomycin resistance.
Oh, yes. The resistance mechanism that Dalbavancin couldn't tackle. So Oritavancin can actually combat those super resistant Enterococcus infections.
That's right. It's like having a secret weapon against those tough bugs.
That's incredible. What makes Oritavancin so effective against Vanna VRE?
It has a specific modification in its structure that enhances its ability to bind to and kill those resistant bacteria. It's like a key that fits perfectly into the lock, disrupting the bacterial cell wall and causing them to burst.
So it's got this enhanced activity against resistant strains.
Yes.
What else is special about Oritavancin?
Well, it also has an impressive half-life, about 245 hours. With a terminal half-life of 8 to 10 days.
Wow, that's even longer than Dalbavancin.
Yeah.
So we're talking about a single-dose treatment option here, too.
Oritavancin is typically administered as a single 1,200 milligram dose over 3 hours.
So it's a longer infusion time compared to the others, but still just one dose is pretty remarkable.
Right.
Imagine the convenience and how much easier it would be to stick to the treatment plan.
Yeah.
No more remembering to take pills multiple times a day.
Exactly. And like with Dalbavancin, no dose adjustments are necessary for patients with kidney problems.
Okay.
Because it's primarily eliminated through other pathways, not the kidneys.
That's great news for those with compromised kidney function.
Right.
It sounds like Oritavancin is pretty flexible and well tolerated.
It is, however, there's one important thing to note regarding administration.
Okay.
Oritavancin should only be diluted in a specific solution. 5% dextrose in water.
Why so specific? What happens if it's mixed with something else?
It's incompatible with normal saline,
Okay.
a common intravenous solution. Mixing them can cause a reaction that forms precipitate,
Okay.
which is essentially a solid that forms in the solution.
So it's like a chemistry experiment gone wrong. Not something you want happening in an IV bag.
Definitely not. Now let's talk about side effects.
What?
The most common side effects reported with Oritavancin are nausea, vomiting, and headache.
Sounds pretty similar to the other lipoglycopeptides.
Yes, but there's one unique concern with Oritavancin. In clinical trials,
Okay.
there were more cases of osteomyelitis reported in the Oritavancin group compared to those receiving vancomycin.
Osteomyelitis, that's a bone infection, right?
Yes, so it's important to monitor patients for any signs and symptoms of osteomyelitis,
Okay.
such as bone pain, swelling, redness, or fever. If it's suspected, alternative antibiotics should be considered.
Got it. So while Oritavancin is a powerful antibiotic, it's important to be aware of this potential risk.
Absolutely. And another important consideration is that Oritavancin should not be used with heparin, a blood thinner,
right?
Because it can interfere with a specific blood test used to monitor heparin therapy.
So doctors need to carefully consider all the medications a patient is taking before using Oritavancin.
Exactly. It's all about making informed decisions to ensure the best possible outcome for each patient.
Okay, so we've met all three of our lipoglycopeptide superheroes.
Yes.
Telavancin, Dalbavancin, and Oritavancin. Each one has its own unique features, strengths, and potential considerations.
It's like having a specialized team of antibiotics ready to tackle different types of infections.
That's a great way to put it.
Yeah.
Now, do you think you could give us a quick recap of the key points for each one?
Sure.
Just to make sure we've got it all straight.
Absolutely. Let's do a quick review of our lipoglycopeptide all-stars. All right, let's do a quick review of our lipoglycopeptide all-stars.
Okay.
First up, we have Telavancin. It's got that awesome dual mechanism of action hitting both the bacterial cell wall and the cell membrane.
Right, like a double whammy attack.
Exactly.
But we have to remember that it can interact with certain other medications and has the potential for some unique side effects.
Yes, very important considerations.
Okay, what about Dalbavancin?
Okay. Dalbavancin, the champion of convenience, with its incredibly long half-life.
Yeah.
We're talking about potentially needing just one dose for an entire course of treatment.
Talk about making life easier for patients.
Absolutely.
But we learned that it's not effective against all types of vancomycin resistance.
Right.
Specifically the Van A type.
That's correct.
And finally, we have Oritavancin, the Van A slayer.
Yes.
It can tackle those super-resistant enterococcus infections that Dalbavancin can't.
That's right.
It also boasts a single-dose regimen, making it another convenient option.
It is.
But we have to remember that there's a potential risk of osteomyelitis with Oritavancin, and it can't be used with heparin.
Very important points to keep in mind.
So there you have it, 3 powerful lipoglycopeptides, each with its own unique profile.
It's like having a specialized toolbox for fighting bacterial infections.
I love that analogy.
Yeah.
It really highlights how important it is to choose the right tool for the job.
Absolutely.
Considering all the factors like the type of infection, patient's individual characteristics, and potential drug interactions.
Couldn't agree more. It's all about personalized medicine, finding the best treatment strategy for each individual patient.
Okay, before we move on to our final challenge, I want to touch on one more interesting point from the lecture slides.
Okay.
It talks about how these long-acting lipoglycopeptides can actually help reduce hospital stays.
That's a crucial point. Think about it. With their long half-lives, some of these lipoglycopeptides allow for a single dose or a much shorter treatment duration compared to traditional antibiotics.
So instead of being hooked up to an IV in the hospital for days on end, some patients might be able to get a single dose and go home.
Exactly. In some cases, it might even be possible to avoid hospitalization altogether.
Wow.
This not only improves patient comfort and convenience, but also helps to reduce healthcare costs and free up hospital beds.
Wow, that's a win-win for everyone involved. It's amazing how these medications are not only fighting infections, but also potentially changing the way we deliver healthcare?
Absolutely. It really highlights how innovation in drug development can have far-reaching benefits.
Okay. Are you ready for one final challenge before we wrap up?
I think so. Hit me with it.
Let's test your knowledge with a multiple choice question.
Okay.
Here it is. Which of the following lipoglycopeptides is not effective against Vanna-resistant enterococcus?
Right.
Is it A, Telavancin, B, Dalbavancin, or C, Oritavancin?
Right.
Think back to our discussion about which lipoglycopeptide can tackle those super-resistant enterococcus infections.
Okay.
Take your time. What's the answer?
The answer is B, Dalbavancin.
That's right.
Remember we talked about how Dalbavancin is inactive against the Vanna phenotype, while Oritavancin is specifically effective against those Vanna-resistant enterococcus infections?
Boom. There you have it. If you got that one right, give yourself a pat on the back. You've officially mastered the world of lipoglycopeptides.
Or at least you're well on your way to becoming a lipoglycopeptide pro.
And that brings us to the end of our deep dive into this fascinating world of lipoglycopeptides.
It really is a fascinating class of antibiotics.
We've learned so much about these powerful antibiotics, how they work, their unique characteristics, their strengths, their weaknesses, and even how they're impacting the way we deliver healthcare.
It's been a truly enlightening journey exploring the cutting edge of infectious disease treatment.
I couldn't agree more. I hope you, our listeners, feel empowered by this knowledge.
I hope so, too.
Understanding these medications can help you have more informed conversations with your healthcare providers and make the best decisions for your health.
Absolutely. Knowledge is power, especially when it comes to your well-being.
And remember, this is just the beginning of your exploration into the world of bugs and beyond.
There's so much more to learn.
There's so much more to discover in this fascinating realm of infectious diseases.
For sure.
We'll be back with more deep dives, uncovering the mysteries of microbes and the amazing ways we fight them.
Until then, stay curious and stay healthy.
And don't forget to hit that like button, subscribe to our channel for more fascinating deep dives, and share this episode with anyone who might benefit from this knowledge. We'll see you next time.